Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey there, everyone. I'm Dr. Burton, the host and creator of the Dr. Mama Says podcast. As always, I thank you so much for tuning in today. Recently, I've released a couple of episodes that have started to introduce you to the sinus cavities, what they are, where they're located. I've talked about how you can diagnose sinus infections, and then last time I talked about what are some of the best treatment options. So continuing in that vein, I want to talk today about what happens when sinus infections are not treated or not properly controlled. You know there can be a complication, but did you know that there are some very serious and dangerous complications of sinusitis? Although sinus problems are common, some of the most devastating and dangerous sinus infection complications are not well known. By better understanding what these complications are, I hope people will become more committed to treating and preventing sinus infections and not just say, oh, I have another sinus infection. It is not okay to say every April I get a sinus infection or I get a couple of sinus infections a year. There is an underlying problem that is there that if we're not careful, that can go on to lead to a complication. Just because something is common doesn't mean that it's good or that it's not serious. Surgeons and intensive care physicians are usually the ones that see these rare but possibly deadly complications. My goal is to help more people avoid the possibility of them occurring. Now remember, most sinus infections are not caused by bacteria. They are indeed caused by viruses. So the problems are not always related to not getting the right antibiotic or not using antibiotics enough. Once the sinuses become blocked, regardless of cause, severe and dangerous complications can begin. As I mentioned, surgery is usually involved in treating these complications. However, after curing the problem, draining the infections, long-term consequences can linger, and no one needs that. I won't get into the basics of the sinus infections because I think I've covered that pretty well in some of the other episodes. So the routine symptoms of a sinus infection are not the complications. In the medical field, when we talk about a complication, we really are talking about a secondary disease or problem that happens because there is already an existing problem. In other words, we prefer to just treat the main problem, that one problem that you have, and not have to focus our attention on a new one because we weren't able to finish treating the first problem. As I start talking a little bit more about these dangerous sinusitis complications, it's important to think about the anatomy of the sinus cavities. I've already talked about that they are these hollow walls in the bones of your face. They're surrounded by important structures like the eyeball, the brain. There's some major blood vessels back there. So it only makes sense that if an infection of the sinuses gets uncontrolled, it's going to spread into these nearby structures. So understanding when a complication is occurring from a regular sinus infection is a really important thing to be able to sort out because you can prevent a life-threatening complication from progressing into something that's even worse, a pure catastrophe. Yes, these problems are real. They are rare, but they can happen. There are many ways to list and discuss what these complications are, but I'm going to choose to just talk about them based on the area. And I'm going to break them down into one of these four categories: the eye, the brain, the bone. And then the fourth category is sometimes I'll say the sinus cavity, other times I'll say local complications. But anyway, the things in this category, as I talk about it more, you'll know what I'm talking about. So let's get started and talk about the sinusitis complications that can affect the eye. When an infection in the sinus spreads to the nearby eye, several different things can happen. Sometimes there's significant swelling in one eye, and that is generally a characteristic sign. Yes, both eyes can be affected, but that would be a really, really bad thing. Some of the signs and symptoms that the sinusitis complication has happened is you have swelling around the white part of the eye. It looks like the eye is much more prominent and bright, like it has grown in size. You can see pus draining out of a swollen eye. Okay, pus draining anywhere is never really a good thing. Maybe you're going to see pus draining out of the tear duct. Maybe you're going to see pus draining out from the sides of the eyes. That is a really bad complication. Don't just think there's mucus built up in the eye. That's an emergent complication. You can see redness of the eye or the eyelid. If you just have some redness on the superficial part of the white parts of the eyes, Maybe that's not so bad. Is there some redness on the upper part of the eyelid? Is there redness on the upper and lower part of the eyelid? All those things mean something different to physicians, so don't just have these at home and watch them. Is there swelling of the eyelid? Redness is one thing, swelling is another thing. Again, is there swelling just on the upper eyelid? Is it on the lower eyelid? Has the eye started to become so swollen it is difficult to open? Obviously, the more swollen it is, the more significant that infection can be. Sometimes when you look at the eye, it looks like the eye appears to be bulging out of the head. That is not a good sign. That is saying not just that the eye appears swollen and bright, not the white part, that's almost as if the eye is being pushed forward, and it can be. It can hurt when you move the eye. Moving your eye side to side, we're using eye muscles. If those eye muscles become inflamed, it hurts when you move the eye. Sometimes you can't move the eye. You're trying to move the eye and it's stuck. That's a bigger inflammation or infection of the eye muscles. That is a bigger complication. And then, of course, the dreaded symptom that anytime you talk about the eye, changes or loss of vision. Maybe you think that you just have a little blurred vision because you've got a minor problem like swelling from an allergy or conjunctivitis. But if you notice any visual changes with whatever medical problem you have, you should seek medical attention. I have seen patients with some of these eye symptoms that have lasted for days because they think that they know what the problem is. For example, you went camping. Your allergies flared up. You got a headache. Your nose got more congested. But you keep doing your basic allergy management because you're on vacation. You're ignoring those symptoms, but you just know the symptoms aren't getting better. When you finally get home, you notice that there is some redness on your eyelid. But again, you decide that's because you've been rubbing them with an itchy eye because of allergies. So you keep doing your allergy management. Then your eyelid starts to swell and you decide must have been a bug bite. So you got a little swelling from a local bug bite. All of these things are a possibility, but they're not a normal thing. So when you start seeing symptoms that aren't the typical normal ones, I suggest you see your physician. When you get that blurred vision, again, you might just think swelling because you got the itchy, watery eyes from an allergy, but blurred vision with a sinus infection is not a good thing. So eventually, once people get to this point, they decide enough is enough, and then they go to their local urgent care or their walk-in clinic. The walk-in clinic doesn't know you. They just hear your story and things sound awful. So once you get there, I can promise you, you have a really, really good chance of getting almost a standard treatment, which is an antibiotic and an oral steroid. Okay, as an aside, I am amazed at the huge numbers of people who get a course of steroids for every infection that they seem to go to the urgent care for. Steroids have significant risks, and I've seen them doled out right and left for lots of different infections. Severe ear infections. Patients come to me being on oral steroids for an ear infection. That is just not the normal way to treat things. But when you go to an urgent care, the people who are treating you don't know you, and they are thinking, what if something bad is happening? And so they're hitting you with this steroid. It's almost like a nuclear option, saying stop the swelling everywhere. Instead of focusing on a particular area, they're looking at the global, give an antibiotic to treat infection anywhere, a steroid to treat inflammation everywhere. No. Unless you woke up with a critical problem that needs to be addressed right now, if it has been progressing in some sort of pattern, the first call you should make is to your primary care. Let them know what's happening and see if they can work you in because they know you. They know your history. Do you have a history of sinus? What other medicines you've been on? A lot of times that is not addressed when you go to a walk-in clinic. You will walk in and you will walk out with an antibiotic and a steroid with no particular follow-up plans. If you do follow up with your primary care a couple of days later, they don't have a good baseline. Is your swelling better? Is it worse? We now rely on you to say, is that redness better? It would have been better if your primary care had seen the redness and 3 days later, the redness might have been slightly better, but not enough for them, and that might have prompted them to proceed with a more thorough or deeper or more extensive evaluation. All right, now back to the eye. Depending upon the location and degree of infection in the eye, there are several different types of complications of sinus infections that can impact the eye. Let me pause right here for a minute. I seem to do that a lot, get off track, but sometimes this background is helpful. I'm going to pause for a minute and give you a little bit of anatomy about the eye because it helps to understand the different levels of complications. When I say eye, it's more than the eyeball. When we talk about infections, we're really talking about the eyeball and all the things around it. It's actually called the orbit. The orbit is the bony area in the skull where the eyeball is sitting, surrounded by fat, muscles, nerves, and blood vessels. So when I say eye, I really mean the orbit, or the orbital cavity that holds all these things. But I'm just going to keep on saying eye because it's just a little bit weird to say orbit. Anyway, the eyelid protects the eyeball and all the things that are surrounding it. The eyelid itself has two different layers that are separated by something called the orbital septum. There's that word orbit again. But this septum is actually a thin fibrous tissue that separates the superficial part of the eyelid from the rest of the deeper structures. If an infection is limited to the soft tissue above this septum, closer to the front of your face, it tends to be a less severe infection, and it's called preseptal, in front of that septum. If the infection gets past that septum into the orbit, that's where the really bad things can happen. So when a sinus infection causes swelling and symptoms in the eye, physicians know that it's critical to quickly determine how severe it is to prevent permanent problems. There are 5 categories for these eye infections. Category 1, there's some basic swelling and redness of the eyelid. It's called that preseptal cellulitis. It's limited above that septum. There's normal vision and good eye movement. Category 2, there's some swelling and inflammation that now is starting to involve the deeper eye structures. So this infection is called orbital cellulitis. It's an inflammation of all the contents in that bony orbit of the skull, and there's varying levels of infection, but generally your vision is normal, but there may start to be a little bit of pain when you're moving the eye. Category 3 occurs when there's something that's called a subperiosteal abscess. I know these are big words, but all bone everywhere in our body has a layer of tissue over it called periosteum. If any infection collects between the bone and the periosteum, the infection can't spread to nearby tissues, but it collects and makes an abscess. In the case of the eye, this usually happens when the thin bone between the eye and the sinus collects that infection, and this bulging abscess trapped underneath that periosteum pushes the eye and causes the eye to have some pressure. This makes your eyeball change its location, and it looks like when you're looking forward, your eyeball is looking down and to the side. That location of the eye makes us concerned immediately for an abscess that needs urgent surgical treatment. The eye movements are limited, and the vision is usually still pretty good at this point. Group number 4 is the orbital abscess. That means that the infection actually broke through into the orbital contents, and you have a collection of pus in the orbit. The eye movement is significantly limited. There is severe swelling of the eyeball, and there are starting to be some changes in the vision. Category 5 is the ugly one. That's where infection now goes into the blood vessels. They can lead into infections into the brain. They can clot off into blood vessels and cause huge problems. This can then lead to some permanent loss of vision. So on that note, with the ugliness of the eye spreading toward the brain, let's just go ahead and talk about sinus infections that spread into the brain. Some of the signs and symptoms that a dangerous sinusitis complication has spread to the brain is worsening headaches, not your regular sinus headaches, pressure, but this is a mega monster headache, not something you normally feel. You have some sleepiness or confusion, maybe seizures, neck stiffness, vomiting, maybe trouble focusing or paying attention, maybe overall sluggish behavior, personality changes. These are not normal symptoms of a regular sinus infection. So even without the pus or the swelling, if you have some of these, see your physician urgently. Just like with the eye, depending upon where the infections are, different complications. Meningitis can happen when the infection spreads into the brain and irritates the liquid and the tissues that are surrounding the brain. An epidural abscess, another big word, it means that there's an infection that collects between the skull bone and the brain lining. It's kind of like that trapped infection that I talked about in the eye, where it was called a subperiosteal abscess. This is an epidural abscess. It's an abscess that's outside of the brain, but next to the bone. The next category, brain abscess. The infection now breaks through the lining of the brain and collects into the brain tissue itself. And then the last category, again, that catastrophic, we have now started to inflame and infect some of the big blood vessels in the brain. They can become infected, they clot off. When a major blood vessel clots off, lots of bad things can happen. Phew! Now let me stop being Debbie Downer and actually now talk about some of the complications of sinus infections that are not as severe, not as life-threatening, but still they need to be diagnosed early because they can progress to these uglier ones I just talked about. For instance, some of the sinus infections lead to complications that are limited to the sinus cavity or to local structures. So this is that last category I was talking about. If the infection just smolders in one place, it can actually infect the nearby bone. Both acute and chronic sinus infections can spread to the bone, and they cause an infection called osteomyelitis. Although this type of infection can actually happen in the maxillary sinus in your cheekbones, it most commonly happens in the frontal sinus, and it spreads to the forehead bone. Once it's in the forehead bone, it leaks to the nearby tissues and causes a lump-like swelling in the middle of the forehead. That's called a Pott's puffy tumor. No, it's not a tumor, it's a collection of infection, but that's the name that we give it. This infection can continue to progress and actually leak forward through the skin onto the face, just like any other draining abscess, except there's also still underlying infected bone. On the other hand, the back part of the frontal sinus can have that bone infected, and the abscess can leak through the back of the frontal sinus into the brain, and then all the other infections that I just talked about with brain complications can happen because the infection of the sinus in the surrounding bone wasn't recognized and treated early. Infected bone can be very difficult to cure. Yes, surgery happens to open things up, but then there can be a long course of IV antibiotics that are needed. Another way sinus infections can cause complications in a local way is by being trapped in the sinus and actually making something called a mucocele. Mucoceles are chronic cysts that develop in the sinuses because of the blocked drainage site. They can continue to grow and expand, and when they get larger, they can cause the nearby bone to thin, which lets them then spread to the nearby structures of the brain and the eye. Sometimes these are really small and cause no symptoms at all. They can be found on x-rays that are done for other reasons, like dental x-rays. When they are accidentally found and no symptoms are noted, you may not need to do any treatment, but it does indicate that chronic sinus inflammation has been happening. And perhaps we need to pay more attention to see, do you have sinus problems that you've not noticed that perhaps needs to be treated before these mucoceles become bigger and more of a problem? Nasal polyps can also occur and develop in the sinuses as a result of chronic inflammation and poor sinus drainage. They also can continue to expand. They can grow into surrounding tissues and cause all the other ugly complications I've talked about. But many times the nasal polyps are not discovered until they expand into the nasal cavity. Based on all these complications that I've talked about, I now hope everyone better understands the importance of aggressively treating sinus infections, not just getting antibiotics and calling it a day, dealing with the nasal inflammation that happened to close off that sinus. Are you doing your nasal saline washes, my favorite nasal treatment in the world? Are you doing nasal steroids, antihistamines? What are you doing to keep that sinus open to allow drainage to happen? My basic take-home message is if your symptoms don't improve, please follow up with your physician. It may be, quote, just a sinus infection, but now you know just a sinus infection can become a severe complication. It's never a good idea to just let sinus infections run their course without some attempt at treatment. So work with your physician to figure out what you need to do when your sinuses become inflamed. All right, then. This looks like a fabulous place to end, so for now I gotta go. If you know someone who could benefit from hearing some of my tips, I'd be honored if you could share my podcast with them. But thank you for joining me today, and I hope you come back and check out another episode soon.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to iTunes and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in this episode, a summary of the show can be found on www.drmamasays.com. And don't forget to subscribe. Hope you come back and listen again soon.